Good evening. I'm Ken Bastida.
And I'm Elizabeth Cook. A live look across the Bay Area right now. We are just hours away from a new curfew taking effect in 2 more counties. And a statewide lockdown could also be on the way. This is where the Bay Area stands right now. Every county except Marin is in the most restrictive purple tier. Marin still in the red, at least for now. And it's not looking good statewide. California reported more than 14,000 new cases in just the last 24 hours. The positivity rate continues to climb, now over 6%. Hospitalization rates jumped more than 4% in 24 hours, with more than 8,500 patients in the hospital right now. KPIX5's Andrea Borba is in San Francisco with all the late-breaking developments. Andrea?
Well, the governor's press conference was pushed just to 12:30 this afternoon, 30 minutes after it was originally scheduled. They came out with a flurry of information in this case, talking about exactly what the data is they're looking at. And among that is spiking case rates well above, thousands upon thousands of cases above that spike we had in July.
Remember when the initial shelter-in-place order was issued in March? Some California counties already in purple tier could move back to that as COVID-19 case rates shatter previous records.
Working with our local partners to make sure what we do is both impactful and as time limited as possible.
With test positivity rates statewide above 6%, there is concern about hospital capacity in this latest surge.
Even when we might only be using 70% of our total hospital beds across the state, we're using over 100% of the projected current capacity of intensive care unit space.
At the moment, 75% of the ICU beds in California are filled, with 112% capacity expected by Christmas Eve. In the Bay Area, 72% of beds are filled right now, with 91% capacity expected by Christmas. Some plans made back in March, including field hospitals at Arco Arena in Sacramento, are back in play again as the virus surges. In addition to beds, the state is looking to staff those beds with people who signed up early on.
And right now we have 871 individuals that are active and registered as part of our health corps. We're going to be dusting that off.
According to Dr. Mark Galley, restrictions now mean hospitals won't be overrun in a month.
We need to bring the hospitals into a situation that they can handle the incoming patient numbers and provide high quality care in a way that protects our healthcare workforce as well.
These moves all come as San Francisco and San Mateo counties move into the state's purple tier. The counties join much of the state in very limited indoor activities and a 10 p.m. to 5 a.m. curfew beginning today.
Now, Andrea, when could all of this happen, these massive changes, if they need to come?
Well, Liz, they could come before the end of this week. They could come before we hit next Monday at this point. The state is looking at moving very fast and aggressively to try and contain cases so we don't hit those ICU overruns that we saw on the state's charts of what they are predicting by the time Christmas Eve rolls around.
Let's hope that doesn't happen. All right, Andrea, thank you.